Hi, I'm Sabena. I'll be starting off. I work with Palliative Care WA's community education, and as well as having a professional interest in advanced care planning and palliative care, I've got a personal and family interest in those areas. So I cared for mum and dad up to the end of their lives over the last couple of years. So I have a real personal passion for the value of these conversations.
Good afternoon, I'm Davina Porock. I'm the Professor of Nursing at Edith Cowan University, and I also have a personal experience with being a carer for my father with dementia, and then my husband who had motor neurone disease and who passed away a few years ago, and now my mother who's managed to last to 92, so we're doing well there. So we come from both perspectives of a professional and personal.
So today we're following the theme of planning and also the theme of stories and journeys. So we're going to be talking to you today about advanced care planning, and we want to start with values. You're all here because you care, whether that's in your personal lives or your professional lives, and there's a whole range of values that underlie that for us as individuals, as carers WA. And if we think about Australia as a whole, if I was to say to you, and I do this regularly in workshops, I give people a whole list of things, what's important to you? And universally, people will say to us, we want quality of life. We want to be able to have dignity. We want to remain independent. We want to retain our decision-making capacity. We want to remain comfortable. And if I say, well, what about a long life? Well, occasionally someone will say, I want a long life. Mostly if I say, well, if you had to choose between quality in life or a long life, quality of life generally trumps. So that's what we want as Australians. We want to be comfortable, we want quality of life, we want dignity, and to avoid pain and suffering. If we look briefly to medicine, if I was to say to you, well, what's one of the main aims of Western medicine? Overwhelmingly, people generally say, oh, it's actually about keeping us alive, giving us a long life. And of course, for most of our lives, we're going, thank you very much for that longer life. That's great that I can enjoy this or that or the other. However, right at the end of life, our lives can be prolonged at the expense of our quality of life. And what also can happen at that end of life is that up to half of us, or increasingly even more than that, aren't able to communicate our wishes at the end of life and or make decisions at the end of life. So if we put that together, if we put that as community we're saying we want quality of life, then we look at Western medicine which gives us a really long life and prolongs life, but at the end of life we can't speak up for ourselves. What do we get? Well, unfortunately, what we get often right at the end of life is poor health, chronic illness, less capacity to make decisions, more hospitalisations, and a whole pile of medical treatments that we don't always want, that can be intrusive, unwanted, intensive, and of course expensive for the medical system. So where does that leave us? What do we do? What can make a difference? Well, what makes a difference, and exactly as we heard earlier, is planning ahead. So we're talking about planning ahead today, but in a different area. This is about planning ahead for your healthcare at the last stage of your life and helping our loved ones plan ahead for their healthcare at the last stage of life. So with Mum, my mum died with advanced dementia, and we were very fortunate that while she was still well, we were able to have conversations about what she wanted. She knew what was ahead. Her siblings had all had dementia. She'd had friends who she'd visited all the way through, and she knew she didn't want to be living with advanced dementia, and she let us know that, and she was also able to put her wishes in writing while she still could. And that's what we call advanced care planning. So the person is at the centre, they're doing some thinking. They're thinking about what matters to them, what's going to be a priority at the last stage of life. They're having conversations, and again, a theme from earlier today, having those conversations. Putting your wishes in writing and sharing that. Advanced care planning, so to get that sense of, and being able to help your loved one and yourselves have the health care and have the last stage of their lives as they want it to be. What are the benefits of that? Well, there's heaps of benefits. There's benefits for the person. The person themselves then gets the end-of-life care that they want. They have access to palliative care that's more likely to have increased access to palliative care that they want for themselves, and those fewer hospital visits and a decrease in that unwanted medical treatments. There's also really key benefits as carers and family. I know for me as a daughter, it was an immense lifting of burden to know that I wasn't making decisions for Mum when she could no longer speak for herself. I was enacting her wishes. I was enacting the wishes that she had shared with us earlier. So less stress, less anxiety, and of course it's such a tough time, and all that grief process is greatly aided when we know we're enacting a person's wishes and that they're getting the end of life that they want for themselves. And of course that decrease in hospital visits and all that kind of unwanted medical treatments is a benefit for us as family and carers at a practical level, as well as knowing that our loved ones are being spared all that.
Thanks, Sabena. So I'm going to move on to our evaluation of the advanced care planning workshops that Sabena runs for Palliative Care WA. And just before I start, I just wanted to sort of bring this a little bit home. I think one of the ways in which we get... the slides disappeared. Yeah.
It's still there.
Okay. One of the ways in which we have that extended life is because the conditions that we get become chronic, and they're managed so well that they become chronic conditions. And as you can see on this slide, there's a few statistics about Australians. I think what I wanted you to remember, but to sort of bring it home, and hopefully not too much with a thud, the chronic conditions are actually long-term managed terminal conditions. So even as carers ourselves, not just the people that we're caring for, we often have conditions that we're managing as well. And I think that that's really important for us to remember, that these are actually terminal conditions. And so this idea of advanced care planning isn't something for, years in the future, it's for now. And I'm not going to read them all out, but you can see what it says there, of how many of us are living with chronic conditions in the general public. And when you get over 65, which I will join that happy band in 3 months' time, so 80% of people over the age of 65 have one or more chronic conditions. 70% of people say in Australia consistently say they want to die at home with their loved ones around them, pain-free and comfortable. But less than 15% of Australians do, and that includes the accidental deaths and others at home, not just the planned deaths. So it's, and that's partly due to poor uptake of planning. And apparently, it's quite shocking, less than 10% of people in West Australia have an advanced health directive. And I was presenting at my workplace in Edith, Cowan University the other week on my other program of Dying at Home program of work, and challenged my colleagues about how many of them had a health directive. Nobody put their hand up, and that's the people teaching nurses. So don't tell them I told you. So we have conducted an evaluation of the planning workshops, and many people know that the immediate effect of the planning workshops is that people learn lots and gain confidence, and that that translates a little later into actually completing advanced health directives. So what we were interested in saying, well, what happens in the longer term? What happens, and what happens to the people who are helping those 50% or more people who are unable to speak for themselves? We call them the surrogate decision makers. And so what we did was we planned to access as many people who'd been to the workshops, whether they'd been the person who'd been intending to make their own plans, or whether they were the carers who were going to help enact those plans. And we interviewed them. And we also did interview some health professionals who had been to the workshops as well. And but this particular part of the evaluation, we focused particularly on those who had become surrogate decision makers. The first story I want to relate from the findings relates to someone who was at a workshop and had made a plan, but had experienced the death of her husband without one. In the last month of my husband's life, things were getting so difficult. We wanted him to be kept pain-free. We wanted him to take him off other medication because it was just so hard for him to swallow. Just keep him pain-free. We knew that is what he wanted, but he'd not discussed this with the doctor, and he didn't have anything written down. And the doctor that was treating him said, if I take him off his blood pressure pills, he could have a heart attack. Are you trying to kill him? He was just a dreadful, dreadful doctor. That last week of my husband's life, he didn't eat or drink anything. And we had to get extra people in to agree to give him morphine. He had no good pain relief. It was just so hard that I said, I don't want my family to have to go through watching me in that similar situation, and I don't want to go through it either. So, soon after my husband died, I sat down with a gentleman from Palliative Care and did my advanced care plan. And my kids got copies, and it's all fine, and I'm very happy. So that was one without motivating someone to do something about it. All sorts of people can become surrogate decision makers and carers for people enacting their advanced health directives, and it's very important. Not all families get on perfectly well at this last stage of life, and this is a story from a sister. Making decisions on my sister's behalf was challenging, but I was able to do so because of the skills I gained from attending the Palliative Care WA workshops. The family was not supportive, and I had to tell them what her wishes were. Her bowel cancer had spread so much, all she wanted were comfort measures. I rang them all, the sisters' children, and told them that I was turning off a life support, and then gave them time by which they could come and say their goodbyes at the hospital. They had to go one at a time because of the disruption they had caused in the hospital. I was able to do that because the workshop trained me and gave me confidence. That's a really strong, compelling story. A husband. When my wife deteriorated, she was being cared for at home with assistance from our service provider. Her pain could not be managed at home, so our GP organised her to be admitted to hospice. That same day, the resident doctor at the hospice asked me about my wife's wishes in relation to her care. He also asked if she had an advanced health directive in place, which I confirmed. The doctors advised me they would take good care of her and would provide care strictly in accordance with her AHD, Advanced Health Directive. It was lovely to hear, and that the hospice would respect her wishes. I'm so glad Palliative Care WA came and helped us with the documents. And the final story is not a family member who was a supportive surrogate decision maker and helper. It was a friend, a neighbour. It was just about 3 months after attending the workshop and completing the Advanced Health Directive form that my friend and neighbour had a fall in his bedroom and broke his neck. His only brother was overseas. When he arrived, he wanted all the treatment, but I knew that my friend did not want to be kept alive for the sake of being alive. Visiting him in hospital became difficult for me since I was not family. When I managed to get permission to visit, I made sure that the Advanced Health Directive was provided for the medical team. The Advanced Health Directive was well written, having been assisted by Palliative Care WA with the wording. I also felt it was my duty to advocate for him because I knew what he wanted. At the end, I was holding his neck and face, which was the only part of him that he could feel. I was with him when he died. The advocacy I was able to give would never have happened if I hadn't gone to the workshops and got help on how to properly complete the Advanced Health Directive and how important it is. Having seen what happened to my friend, I want to make sure I'm certain that my Advanced Health Directive will be found and used when required. It went on my health record. My GP has it. I have alerts in my home saying I've got one and where it is. I have alerts everywhere because I live alone. That just gives you a flavour. The report is completed and will be on the website of Palliative Care WA at the end of the month.
I'm sure you're as moved as I am hearing those very compelling stories. We're enormously appreciative to Davina and the team at Edith Cowan University for the work that they've done. So as Davina said, who she was talking to were people who'd come to our advanced care planning workshops. They are free workshops, they're face-to-face as well as online. We run them around the metropolitan area, and you can look at our website on our events page, and we've got little flyers here if anyone's interested and wants to join. We would really love to see you at our workshops.
As you could probably imagine, we have a few questions for you. I'll start off with the first one. How can we support carers and partners to value and enact their loved ones' wishes where they may differ from their own?
Do you want to take that one?
So how can we support carers to enact their loved ones' wishes? That's a really good question. I think... I think there's a few layers to that. The first is that as loved ones, we just have to remember that this is the person's life and the end of life that they want for themselves. So I think we have to be really clear that is, in general, how things work. That said, and I mean, there's so much, depth we can't go to today. The model that we had up there before had the person at the centre, but that does vary across cultures. Sometimes it actually is the family or even the community who makes decisions for the person. But if we're thinking about in general in our Western society, where we respect each individual's wishes, we really do encourage family to support their loved ones, to have their end of life. And we say to each individual, if you put your wishes in writing, then that takes those hard decisions away from your loved ones. That makes it really clear. The clinicians will go straight to that written document and say, this is what the person wanted. So that's one of the really big values of having your wishes in writing. It makes it very much easier for loved ones and for friends and family.
Excellent. Thank you so much. We've got a couple more questions here for you. Would you suggest doing advanced care planning with any ageing parent, including those who are living well with no illness?
Once you're over the age 18, please do your Advanced Health Directive. Touch wood, I'm healthy and, no known conditions, and my Advanced Health Directive is lodged on my health record, and it's all there. We just don't know what's ahead tomorrow. So please, this is for all of us, not just ageing parents, for absolutely everyone in the room. Please consider doing that directive.
Thank you.
And maybe we should say you shouldn't get a driver's licence until you've done your Advanced Health Directive.
That could be a good condition there. Thanks, Davina. How do we deal with GPs, specialists and lawyers who actively undermine ACP and AHD processes?
Does that happen?
Thankfully, I haven't come across that too often. Certainly in the health area, clinicians are generally delighted to know what the person's wishes are. They don't want to prolong a person's life unnecessarily either, but they do require that guidance. In other areas, I guess we empower community, hopefully, to advocate for themselves. And you heard some great stories there of people advocating for themselves and their loved ones, their friends and neighbours. So we encourage people to do that. If you have any concerns and you feel like you're not being supported, please reach out to us or to Advocare or to... There's many places, Carers WA, to kind of get that advocacy support if you need. Certainly let us know if you're having issues. But generally we're finding people are going, yes, do your planning. And certainly too that in general in the legal system people are also encouraging and letting people know about the health planning as well as will. So thankfully that's what we're generally hearing.
And can I add that in health, when you go in for a procedure now, even no matter what age you are, they will do what's called the goals of care, questioning about what you want to do if your heart stops during this and those kind of, and they're sort of basic questions, not as detailed as values and preferences as we do in advanced care planning. But I think it's that this kind of pre-deciding is essential now, and it actually helps the medical and nursing staff to know what to do so that they're not going against your wishes. And that can mean do everything. No, it doesn't mean always don't try anything or anything like that. So it's not all about necessarily choosing death over life. That's not it at all. It's about your values and preferences and planning for that at whatever age and stage you're at.
Excellent. Because you were so good on time, I've got two quick ones to go, if that's okay. Why are palliative care agencies at times reluctant to administer pain relief in the last few days of someone's life?
That sounds like a rather individual question. Yeah.
And I've had 3 people die in the last 18 months, 2 of which were through palliative care, the other ones were through a hospital.
Uh-huh.
They were so reluctant to give pain relief in the last few days, and there was pain relief present at the household.
So the person was in pain.
Yes,
Yeah.
absolutely.
Yeah.
The nurses are very reluctant to say that they are, to feed it back to the doctors, and the doctors are not.
Gosh. Yeah. Yeah. Yeah.
35 years, and this has been a continual bugbear of mine, that pain relief is not given. And if palliative care is done properly, we don't have to have VAD. We don't have to have those sorts of things available because people are comfortable in their last few stages of life. My mother died in agony.
Well, I'm very sorry to hear that.
Have conversations with her about the fact that she was coming to the end of her life. We had to beg the understanding to discharge her so that she could come home and die at home. So
Yeah.
and this is not that far long ago.
No.
So
That
these are the things that are actually still happening.
still happening. Yeah, it's the funny thing about end-of-life care, at the very end of life, that we still worry about what is happening in the future, like becoming, addicts and things like that, which is... So I'm sorry to pike out on you, but I'm not prepared to answer that question as a general answer, because it's... I think it's very sad that it happened 3 times in your family. So I think we'll have a conversation afterwards, but generally, and that is partly the role of the advocate, and it sounds like you were advocating as best you could, and seeing what you can do to maybe get different carers and things like that. But at the very end, you haven't got a lot of time. So, yeah, I'm very sorry to hear that. Yeah, something to be aware of, everyone.
Yeah, thank you for that. And the very last one is the plan an online form?
Yes, you can complete the Advanced Health Directive in the paper version, and it is also a fillable PDF. Yeah, both of those. But you still need to print it out to get it signed and witnessed.
Wonderful. Thank you so much. Really appreciate your presentation.